Types of graft rejections. Graft rejection is classified into three main types based on the speed at which the rejection occurs and the underlying immunological mechanisms involved. Number one, hyperacute rejection. Hyperacute rejection time frame. This type of rejection occur extremely rapidly, typically within minutes to hours after the transplantation. Mechanism: it is mediated by pre-existing humoral antibodies, preformed antibodies in the recipient. This can include anti-HLA antibodies, which may have been induced by previous blood transfusions, multiple pregnancies, or the rejection of a prior transplant, or antibodies against the ABO blood group system. Pathology: the pre existing antibodies immediately bind to the graft, forming antigen antibody complexes that activate the complement system. This triggers an intensive inflammatory reaction with a massive infiltration of neutrophil into the grafted tissue. Ultimately, this causes massive blood clots to form within the capillaries, completely preventing the vascularization of the new graft. Acute rejection. Acute rejection or early rejection, you can say. Acute rejection. Time frame. This rejection takes days, weeks, or up to months to become manifest. So, early acute rejection often takes place within the first 10 days of transplantation. Mechanism: it is primarily a cell mediated hypersensitivity. Reaction driven by the activation of cytotoxic T cell. It can be further divided based on the recipient prior sensitization. First set rejection, primary response. This is the typical acute rejection when a recipient has not been previously sensitized to the donor's antigen. It takes time for the primary activation of T cells to occur, resulting in dense cellular infiltration and tissue destruction. Second set rejection, accelerated response. If the recipient has been previously sensitized to the graft's antigen, rapid secondary reactivation of T cell occurs. This leads to an accelerated cell mediated destruction, sometimes resulting in white graft rejection in skin graft, where the tissue is rejected before it even has time to heal, marked by a massive infiltration of macrophages and lymphocytes. Chronic rejection, insidious and late rejection, time frame. This type of rejection is insidious and develops months or even years after the initial acute rejection. Reactions have subsided. Mechanism: chronic rejection is a complex and involve both humoral and cell mediated, antibody mediated, and chronic delayed type hypersensitivity of cell mediated immune responses. Pathology: over time, low grade cell mediated reactions and the deposition of antibody or antigen antibody complexes damage the endothelial cells lining the blood vessels. For example, in kidney allograft, subendothelial deposits of immunoglobulin and complement component C3 can accumulate on the glomerular basement membrane. This ongoing damage and inappropriate repair responses cause the walls of the blood vessels within the graft to progressively thicken, eventually become completely black. So, graft rejections. Number one, hyperacute rejection, and number two, acute rejection, early rejection, we can say. Next, number three, chronic rejection, insidious and late rejection. This is graft rejection. Graft rejection, types of graft rejection.